Good evening, everyone. First of all, I would like to thank La Chansi for giving me this opportunity, La Chansi, and my friend Shyam Kumar from Noble Biosciences India for organizing. And today I'm going to talk on shrimp health management, especially the diseases that are important to Indian shrimp farming. So whenever we discuss about shrimp disease, we Dr. Donald Leitner. He is popularly called as father of shrimp. He is from Arizona, and he contributed a lot. Definition of disease. This definition is from World Organization for Animal Health. Earlier it is called as OIE, Office of International Epizootics. So according to this, the definition of disease is any adverse alteration in the health or culture performance of individuals or populations of the shrimp is called as disease. Now coming to the diseases, we all know that even if you take human agriculture or veterinary, even aquaculture, diseases can be divided into three types: microbial diseases by virus, bacteria, fungi, protozoa, and other parasites, and environmental diseases in aquaculture, especially ammonia toxicity or nitrite toxicity, hydrogen sulfide toxicity, low dissolved oxygen stress, and sometimes chemical toxicity, and nutritional diseases. Very few nutritional diseases were reported in shrimp farming. Most popular one is vitamin C deficiency, the disease caused by vitamin C deficiency called as Black Death, and some very few mineral deficiency syndromes were mineral deficiency diseases were reported in shrimp. How do we know that there is disease in shrimp? There are clinical signs and symptoms. So these are the very common clinical signs and symptoms that we can observe on pond site. Anorexia means a lack of feeding, antenna cut, change in the color of the shrimp, sometimes change in the shape of the shrimp, poor growth, size variation, shrimp coming to the surface, mortality, opaqueness of the muzzle, loose shell, melanized lesions or black spots, partial molting, delayed blood clotting time, white fecal matter floating on the water surface, white gut. These are the two entirely different problems. White fecal matter and white gut are two entirely different diseases, different etiologies. Sometimes tail rot, edema. Edema means accumulation of fluid in certain parts of the body. Blisters, change in gill color, and white spots on carapace. All these signs can be noticed when you are doing sampling or even doing check tray observation. Also, you can notice some of these clinical signs. So just have a look at this picture. This is I got it from one of the nurseries. You can clearly see three clinical signs. One is the juvenile is in blue, and one animal, there is an atrophy in the hepatopancreas, and in one animal, in one juvenile, you can notice body cramp. So atrophy of hepatopancreas is most probably due to bacterial infection. Blue pigmentation and body cramp it may be due to nutritional deficiency. Now, in one case, it is carotenoid deficiency. The other case, it is due to mineral imbalance or mineral deficiency. So like this, based on clinical science, we can come to a presumptive diagnosis. It's not confirmative. We can go for presumptive diagnosis. So when it comes to India, these three diseases cause major loss or production loss or economic loss to the farmers. The first one is the white spot syndrome virus. The second one is white feces. And the third one is RMS, running mortality syndrome. We'll discuss in detail about all these three diseases. So coming to white spot disease. So three questions I on especially three questions. Why the mortality is more in case of white spot virus? We have several viral infections in shrimp. Why the mortality is more in case of white spot virus? The reason is it causes damage to the multiple organs like cuticular epithelium, which is responsible for molting of the shrimp. It attacks antennal gland, it attacks heart, it attacks blood cells, it attacks even gills. That is why shrimp die due to multiple organ damage. For example, imagine a person had an accident, lost his leg, he is going to survive. He's lost his hand, he's going to survive. But if there is any damage to any of the vital organs like heart, liver, kidney, spleen, he is going to die. In the same manner, shrimp has some vital organ. But in case of white spot virus, it is affecting or it is damaging multiple organs simultaneously. That is why in case of white spot virus, mortality is more. And another important factor everybody should know is why it spreads fast. This virus spreads fast because there are around more than 100 white spot virus carriers were reported. If you go to OER, World Organization for Animal Health website, there are more than 100 carriers were reported. So because of these carriers, it can spread fast from one pond to the other. And very, very important thing I would like to highlight here is earlier, we don't get white spot virus outbreaks during April and May months during summer periods. But if you see the data from the last 2 years, white spot virus outbreaks are there even during very peak summer. It clearly indicates that white spot virus has been adapted to high temperatures. Uh, there was an outbreak of white spot virus in one of the farms. I visited the farm. Just have a look at this filtration system. Do you find anything wrong in this? If there is something wrong in this, just type R in the chat box. And just look at this filter. There should be minimum of two filters, two filtrations. But there is only one filtration. And that bag is also not properly managed. So next 3 videos, I am going to show one in the front, the second one in the middle, and third one in the back end of this filtration system. Just this. This is after filtration. You can see the crabs. Filtration is to prevent all these carriers to enter into the feeder canal. But if you look at this, already carriers are there in the feeder canal. It has passed through the filter. And then this is the middle part of it. Just have a look at it. There are carriers of crabs. They are the carriers of white spot virus. You can notice a dead shrimp. And let us see the third one, before filtration. You can see this, a lot of mud, live tiger shrimp, dead indica shrimp, live crabs, and shellfish. It clearly indicates that the biosecurity in this farm is very, very poor. And see, this is this crop. They had spot virus in the previous crop, and this crop, after white spot virus, you can clearly see there are 3-stage filtration. And if you look at this video, this was taken during last crop, so many insects are there. So what all these insects will do? Let us see. This is a pond that was affected with white spot virus. They were thinking that it's a Vibrio infection, and they delayed harvesting. You can see the dead shrimp, and you can see all these insects. So once they harvest this pond, all these insects will go to the other pond and will affect the neighboring ponds. This is why white spot virus spreads very fast. And this is very interesting. Look at this netman. He is carrying shrimps from one pond to the other. He is carrying around 4 or 5 shrimps. So this is another way of spreading white spot virus. And now, this is very, very important. For example, if you do netting in a pond that is affected with white spot virus, you must disinfect the net. In disinfection, in net disinfection, two things are very, very important: concentration and contact time. Normally, what we are doing is we are putting little amount of potassium permanganate, dipping it for 1 minute, and then going to the next pond. But if you suspect if there is a white spot virus in that pond, after sampling, if you notice white spot virus suspicion suspected shrimp, what you have to do is you have to keep the net in either in 100 ppm potassium permanganate or 100 ppm chlorine for 10 minutes. Here the concentration is 100 ppm and the contact time is 10 minutes. Below that, it is not going to inactivate or kill the white spot virus. So then, this is a very interesting observation. This report is from Bhimavaram area. It was taken on 19th March. So this farmer, there is a mortality in this pond. Symptoms are typical of white spot virus. This farmer has sent samples to 6 labs. All the 6 labs tested with the rapid test kit. It came negative in all the cases, but the symptoms are typical of white spot virus. Then we'll a PCR test, and we have sent the samples for PCR test. You can clearly look at this CT value. Sorry. So CT value is very, very high. It clearly indicates white spot virus is there, but we are not able to detect this white spot virus using the rapid kit. This is the latest development. We have to further study to make a comment on this. And if you look at this Vibrio parahemolyticus, if you look at the CT value, it was around 27. So there is a clear case of high Vibrio load as well as very, very high white spot load. In this case, the mortality is also severe. Then coming to running mortality. So it's a very loose term. There are several diseases that cause similar mortality. One is carrying capacity. Whenever the carrying capacity is reached, there will be a regular mortality will be there. How do we know that the shrimp has reached carrying capacity? There are certain indications like low dissolved oxygen, feeding will go down, shrimp color will change, then mortality. So the only option during running mortality is either go for partial harvest or go for you can increase aeration. And even in case of mineral imbalance also, there is chronic and continuous mortality. In this case, you can notice some white muzzle if the mortality is due to mineral deficiency. And most of the cases, running mortality is due to Vibrio, which I'm going to explain you in detail. And then even after white feces, there is a running mortality. Even there are some cases of IMNB. You can notice white muzzle and mortality. And there are some cases of rickettsia also with the similar symptoms. So we'll discuss in detail. This is a clear IMNB. You can see on the left, you can see there are the 3 stages of muzzle necrosis. We call it as coagulative muzzle necrosis. And on the right, you can see a shrimp with a red tail. On the bottom, you can see the hepatopancreas. Just above the hepatopancreas, the white patch is called as lymphoid organ. If you take a healthy shrimp, you cannot find this organ. It is not at all visible. But in case of IMNV, we call it as hypertrophy. Its size increases by 4 times, and you can clearly notice lymphoid organ hypertrophy. So if lymphoid organ hypertrophy is there, white muzzle and red tail, you can suspect IMNV. You can send the sample for the PCR for confirmation. And in case of running mortality due to white feces, you can clearly see only the small shrimp will die, not the larger shrimp. So this is 1 or 2 weeks of after white feces, so you can notice this condition. And then coming to the running mortality caused by Vibrio, and this was a report from a very popular scientist, Dr. Indrani Karunashagar. They have clearly mentioned that running mortality is due to a bacteria, Vibrio parahemolyticus, that contains a toxin called as T3SS1. They have analyzed 43 samples from one area, and 57 samples from another area. In 100% of the cases, it is due to P3SS1 toxin. And this report, we have sent samples to RGCA, Rajiv Gandhi Center for Aquaculture. So very interesting to note that. A very interesting point I would like to highlight here is, if you look at on the left-hand side bottom 14th and 15th column, green colonies are only 70 in the water and yellow colonies are around 700. But if you look at the Vibrio count, especially green colonies in the muzzle of the shrimp, it's around 240,000, 2.4 into 10 to the power of 5. So in case of running mortality due to vibriosis, vibrio loads will shoot up to 10 to the power of 5 levels. In a healthy shrimp, it should be less than 10 to the power of 3. Then these are the clinical signs of RMS due to Vibrio. You can see in the first step, you can see the antenna turns red. Second step, tail or uropod turns red. And third stage, you can see look at the top shrimp. Hepatopancreas turns to reddish yellow in color. And in stage 4, you can see the entire shrimp turning to a dark red in color. And sometimes we also notice white muzzle because of very, very high Vibrio loads. And then you can notice weak and red shrimp in check tray, and then mortality in check tray. These are the stages of running mortality. Mortality under one aerator. So this slide, I got it from one of the EMS presentations. It was clearly mentioned that Vibrio parahemolyticus can develop resting forms. What it means is, even after drying, they can survive in the soil. So even after removing the soil also, there are cases of EMS due to Vibrio parahemolyticus. So it shows that Vibrio parahemolyticus can form resting forms. And we have also noticed in RMS where we are getting running mortality crop after crop. So it clearly indicates it can survive even after drying. And another important observation is that even these Vibrio parahemolyticus can survive low salinity also. So normally what we say is Vibrio parahemolyticus is halophilic. That means it loves salt. But recent observation or recent study shows that Vibrio parahemolyticus can even survive low salinity. That's why we are getting RMS even in the low saline waters. So when it comes to management of RMS, so what we are suggesting the farmer is, we are suggesting the farmers to disinfect the water and sediment by applying chlorine. And then we are also recommending the farmers to check for Vibrio parahemolyticus by PCR, especially if you are getting a seed from the hatchery. We recommend the farmers to screen for Vibrio PCR along with other pathogens. Normally, farmers are testing for white spot virus and for EHP. Now we are recommending the farmers to check for Vibrio parahemolyticus also through PCR. So by doing these two things, we can avoid or we can minimize the Vibrio parahemolyticus loads in the shrimp pond. And then coming to the major problem, white fecal matter. So we all know the clinical signs of white feces. So these are the clinical signs: white fecal matter floating on the water surface. Feeding will come down. Sometimes the shrimp start eating sludge. Size variation will be more. Growth will be poor. Eventually, the shrimp will turn to loose shell and then gradual mortality. So this was data got it from one of the acoustic auto feeders. Before white fecal matter, the feed was went up to 224. And if you see, it has come down as low as 72 kgs. Then again, after treatment, it went up to 150 kgs. This difference, we can assume that that much of mortality because of white fecal matter. And this was a picture It's around 14 days old juvenile with fecal matter, and this broodstock with fecal matter. And if you do sampling after first month, if you find this many shrimps, this much of size variation, you can clearly say that this is due to very poor seed quality. And if you do sampling after 45 days, just look at this. Two shrimps are eating debris, and two shrimps has white fecal matter. You can clearly say that uh, the seed is okay, but it got infected with Vibrio and EHP, and you can clearly see that white fecal matter also in the gut. So after that, this is the loose shell. After loose shell, shrimp will die during molting. And see, here we have to know something about hepatopancreas. The functions of hepatopancreas are food digestion, food absorption, transportation of nutrients, and storage of lipids, glycogen, and minerals. So this is a wet mount of hepatopancreas microscope. The lead is 4x, and the right side is around 10x, and this is around 40x. If you look at this, it is a very healthy shrimp, and this is full of lipid droplets. Here, we should discuss about something about bile, and my friend Arun is going to talk about on bile, but I'll conclude very briefly. So bile is produced in the liver and stored in the gallbladder of higher vertebrates. It contains both bile acids and bile salts, and these biles are responsible for assimilation of lipids from the feed that we are given. And shrimp cannot synthesize bile acids or bile salts, so that's why we have to supplement bile through the feed. So look at this picture. There are no lipid droplets at all. It clearly indicates it stopped feeding. And you can see this. This is a wet mount of hepatopancreas. It is full of EHP spores. Once EHP spores are in their cells, cells will die. And these dead cells are very good food for Vibrio, and then Vibrio proliferates. So can clearly see this hepatopancreatic tubule. There are several constrictions due to collapse of cuticulars, hepatopancreatic epithelial cells. And you can clearly see here in the middle, we call it as ATM, aggregated transformed microvilli, another indication of Vibrio infection. And this is the terminal stage, just before death. A loose shell shrimp, if you observe loose shell shrimp under hepatopancreas of loose shell shrimp under microscope, you can see the damage. You can see the melanized hepatopancreatic tubules. After this, shrimp is going to die. So by observing the hepatopancreas condition under microscope, we will be able to guide the farmer whether to go for harvest or to go continue the crop based on the damage to the hepatopancreas. Now, coming to the etiology of white feces. So there are around 4 factors that were scientifically established so far. One is EHB. I'm talking about white feces, etiology of white feces. There are 4 factors. One is EHB. The second one is Vibrio. The third one is anaerobic bacteria that is present in the sludge. And the fourth one is anti-nutritional factors that are present in the feed. These are the 4 reasons so far reported by scientists. So Vibrio is a natural flora. We cannot avoid Vibrio, but we can manage Vibrio. We cannot avoid. And as far as EHP is concerned, there is no treatment for EHP. There is no chemical so far that can kill EHP, but there are chemicals that can inhibit the EHP spore germination. And we'll discuss in detail about anaerobic bacteria and anti-nutritional factors in details in the coming slides. So in Vibrio management, before stocking itself, we have to screen the seed for Vibrio. If the Vibrio loads are high, we have to avoid that particular seed. And during culture, the feed for Vibrio is molting shells, uneaten feed, fecal matter, and blue-green algae. These are the favorable foods for shrimp, and favorable conditions for Vibrio is high organic load, high temperature, blue-green algae,
high salinity and stress regime are favorable for Vibrio prolifications, and poor immunity is also one of the reasons for Vibrio prolification. And latest study shows that we have to maintain a probiotic to Vibrio ratio at 100:1. Earlier, we used to say that we should maintain at 10:1, but now the present study shows that we have to maintain around probiotic to Vibrio ratio at 100:1. And then pH, there is a relation between pH and Vibrio. There was a study in Malaysia during EHP. High pH ponds, Vibrio loads are more. So you have to maintain pH below 8.2. And there are certain chemicals or probiotics or things that can control or that are very popular probiotics, bile acids to maintain the health of the pancreas, phase biotics or bacteriophages to kill Vibrio, immunostimulants to improve the immunity of the shrimp, and there are certain quorum sensing inhibitors that reduce the toxin production from the pathogenic Vibrio, organic acids, essential oils, and some companies are supplying functional feeds also with some of the above ingredients mentioned. And this one is a polyculture, the combination of fish and shrimp that can help to reduce bacterial infections in shrimp farming. And coming to EHP, see, it was first reported in India in 2016, but in our lab, we have noticed this was a report from our lab, screenshot of PCR mission, isothermal PCR mission, IQ Plus kit. It was on 4/10/2015. We have tested around 8 samples. All the 8 samples were positive for EHP. So there are 3 stages of EHP. In stage 1, high diversity of potentially beneficial microorganisms will be there. In stage 2, there is a decrease in beneficial microorganisms, and in stage 3, there is a displacement of beneficial microorganisms by opportunistic or pathogenic bacteria and fungi related to infections. So how some of the hatcheries are addressing this issue is, so they are going for ultrafiltration. With this ultrafiltration, we can filter all the particles less than one up to 1 micron level, so that you can avoid the entry of EHP spores into the hatchery. And it is a publication stating that polychaete worms, a passive carrier for EHP in shrimp. It's in aquaculture, December 2021. So some hatcheries are going for their own SPF polychaete program. This is a video of a hatchery having their own SPF polychaete culture. And then it was reported that Artemia can carry EHP. So now we are not getting very good quality Artemia biomass. That's why most of the hatcheries are not using Artemia biomass. Earlier, most of the hatcheries were using Artemia biomass, but nowadays hatcheries stopped using Artemia biomass since it's a carrier. And then we know that EHP can present in the soil, EHP can present in the water, and EHP can come through seed. So in order to address this, we have to inactivate EHP spores that are present in the soil, EHP spores that are present in the water, and we should stop EHP-free seed. So how do you treat your soil? These are the recommendations from the publications. We have to apply 6 metric tons of burnt lime, or 40 ppm of 65% bleaching powder, or 15 ppm of potassium permanganate, and 200 ppm of formalin. If it is a plastic lined pond or a pen nursery or hatchery tank, you can go up to 3% sodium hydroxide. And this is a lime application. We apply around 6 metric tons, and then after that we pump water. The pH increases shoot to 12, and after 2 days, it will come back to the normal. And this is my favorite method. What we do is we pump water, half-feet water. We apply around 12 kg potassium permanganate. We apply little over 15 ppm. 15 ppm is recommended, but there will be an oxygen demand from the soil and oxygen demand from the water because of organic load. So we apply a little bit over 15 ppm. So around morning 8 ppm, we apply potassium permanganate. Same thing, we spray it on the buns with the help of 1 HP mortar. So by doing this, we can inactivate EHP spores that are present in the soil. This we detect EHP spores present in the soil. And this was publication on EHP spore inactivation. They have clearly mentioned that with 20 ppm chlorine, we can inactivate EHP spores present in water. So first we have disinfected inactivated EHP spores present in the soil. Now, after filling, we are disinfecting the water with around 10 bags of normal bleaching powder, around 20 ppm of chlorine. We can inactivate the EHP spores present in the water. This is another publication stating that this is, as I told, this is the third region, anaerobic bacteria, propanogenium. This propanogenium is present in the anaerobic sludge. So how we are addressing this is a plastic lined pond with the efficient central drain system. So we are not getting white feces in a ponds, P-lined ponds with the efficient central drain system. It clearly indicates the involvement of anaerobic bacteria in white feces. So India insists how we address this anaerobic bacteria is there are different ways. One is pumping out the sludge. The second one is increasing the aeration. If you improve aeration, even in Aqua India, there was one presentation on this. If you can maintain your dissolved oxygen levels above 6 ppm, so you don't get white feces in spite of EHP positive cases. There is a standard in some of the highly successful farms in India. The standard is we keep around 6 HP of aeration for each bag, 25 kg bag of feeding per day. They recommend around 6 HP of aeration. By doing this, they are able to minimize the impact of anaerobic bacteria and EHP on the shrimp. And this was a very, very old publication from Albert Taken, very popular nutritionist. It was around 32 years back. He has mentioned clearly about anti-nutritional factors that are present in the oil seeds. So you have to select a good quality feed in case of the white feces disease. And the last slide of my presentation. So we have to test the soil, disinfect the water to kill EHP spores. And then we can check the seed for EHP. And we also recommending the farmers to stock in the nursery, test after 21 days, select the small ones and test after 21 days. And during culture, you can use gut probiotics, bile salts, and sludge management, bacteriophages, and essential oils to keep the Vibrio loads under control. We cannot kill 100% of the Vibrio, but we can manage the Vibrio. And above all, aeration, dissolved oxygen around above 6 ppm is helping a lot. So that's all for now. If you have any worries, I think we can take up questions after Arun's presentation. Thank you. Thank you very much.